Thank you, Dr. McCulloch. Our next presenter is Dr. Ryan Cole. Dr. Cole is CEO and Medical Director of Cole Diagnostic, serves clinicians throughout Idaho and the nation with expert pathology diagnoses and patient-centered care. Dr. Cole completed his residency in anatomic and clinical pathology at the Mayo Clinic, where he was chief fellow during his surgical pathology fellowship, followed by a year as chief fellow at the Ackerman Academy of Dermatopathology in New York City under the direction of world-renowned dermapathologist, the late A. Bernard Ackerman. Having seen over 500,000 pathology cases in his practice, he is uniquely suited to provide answers quickly and accurately, and I apologize for mispronouncing all these medical terms. Dr. Cole.
Thank you, Senator, and thank you to my esteemed colleagues, and I must commend you at pronouncing those actually quite well, so thank you. It's an honor to be here. I'd like to start really quick with a story. So a high-risk individual approaches me, 50 years old, obese, type 1 diabetic, calls me, I have COVID. This was about a year ago. What do I do? Help, help, I'm going to the ER, my oxygen's 86. I have excruciating pain in my lungs. So I said, you're going to the pharmacy, don't go to the ER. I called in some early treatment medications of the drugs which shall not be named. Said individual calls me a couple hours later and says, you know that excruciating 9 out of 10 lung pain, it's now 2 out of 10, 6 hours later. Well, I know the mechanisms of the medication I prescribed. A few hours later, in the next morning, he calls me, he says, you know that oxygen saturation of 86, it's now 98%. I said, isn't that fantastic? Early treatment works. That individual is my brother. I am my brother's keeper. Now, this virus we have known, as much as we've been told it's a novel virus. Viruses are novel. This is 80% similar to a virus we experienced 2 decades ago. There's not a whole lot novel about this, other than the fact that a few sequences are different. But we're physicians and scientists, and we understand virology. We understand how disease works. So an upper respiratory infection, a virus, will replicate in the body for only about a week. At that point, you only have residual parts of the virus. So these tests that pick up, oh, you're positive still, you're positive still. No, those are the car parts, not the car anymore. So we have a week of intervention to where we can maybe try to intervene and stop the viral replication. Beyond that, we're really just spitting in the wind. Beyond that, then the virus and the phase of the disease becomes an inflammatory one, and we know with this particular disease, a clotting one. Well, in medicine for eons, we have known how to treat inflammation and clotting. So the simple construct or the simple concept that there's nothing we can do, go home, let your lips turn blue, is a false construct. It just takes the will to say, we're smart individuals. I sit here with an esteemed team of bipartisan colleagues from all walks of medicine and politics and life that are highly intelligent, that know how to treat a simple upper respiratory infection and the things, the sequelae that happen after the virus is replicated. So yes, I am my brother's keeper. Yes, I am a scientist. Yes, you're privileged, and I'm honored to be in a room of such intelligent people that know that there is treatment for this disease. Early treatment saves lives. Thank you.
Thank you, Dr. Cole. Our next